live.
Perfect.
Okay, we are live. Good afternoon. This is American Surgery Center Bariatric Program. It is March 3rd, 2021, our Wednesday weekly bariatric journey event with Dr. Irgao. We are going to talk about obesity and the obesity during the COVID time, COVID-19. And we covered this last year a little bit, but this is slightly different with the vaccine being available. And also we have some data that we would like to share with everyone. So I'm going to ask Dr. Irgao to introduce himself, and then we'll start from there.
Thank you, Kemal. Good afternoon, everybody. I'm Dr. Irgao. I am the president of CHRIAS, the Christiana Institute of Advanced Surgery. My area of expertise, my specialty is weight loss surgery or bariatric surgery. Along with my associates at CHRIAS, I am part of a group that is the most experienced when it comes to bariatric surgery in our area. I'm happy to say that with my associates, I set up and implemented bariatric programs of excellence in many of the areas, health systems. The latest one being the American Surgery Center, which is one of the very few ambulatory surgery centers that have been certified as centers of excellence for bariatric surgery by the MBSA QIP. Thank you, Kemal.
Well, thank you, Dr. Irgao. So now let's go ahead and actually open up our presentation. Many of our patients already know and familiar with what we are presenting, the way we are presenting. So, but I'm going to go through with our other surgeons who are part of the program. As Dr. Irgau being with us today, we have Dr. Gail Wynn for 20 years with bariatric surgery, Dr. Michael Peters over 15 years, and Dr. Rolsey and Dr. George Ibrahim who are with us in the last several years. And Dr. Sachin Wade on the colorectal side. And March actually is colon cancer awareness month. And tomorrow, actually, I'm going to have an event with Dr. Wade in between his office hours. While we are on this slide, I have our nutritionists, Amy Wilkerson, Beth Wright, and Fran Tacone. They are with our patients from beginning to the end. And after the surgery, as needed, they are part of the program. And it's great to have them. As Dr. Irgau mentioned, we are the most experienced surgery group in bariatric in United States. So I can say this very comfortably with over 10,000 surgeries, bariatric surgeries in the last several years. And just over the past 3 years, it's over 2,000 total cases being done. Now, these things are important. And Dr. Irgau, you mentioned something a little bit differently. You know, every time you do these events, I pick up stuff in a different way. And one of the things that you said, we have done this in different programs, different facilities. Now, this event is for American Surgery Center. It's one of the surgery centers, only 10 out of 9,300 surgery centers in the United States with the Bariatric Center of Excellence certification. Now, what other programs have you guys done? Have we done? Like, I'm just not going to pretend like I don't know them, but if you can just very briefly mention the other programs that we had in the past.
Absolutely. In Delaware, actually, before CHRIAS set up bariatric surgery in its modern form, there was no modern type of bariatric surgery program. So myself and my associate, Dr. Gail Wynn, did start and set up the Christiana Care bariatric surgery program, having performed laparoscopic gastric bypass, laparoscopic sleeve gastrectomy, laparoscopic gastric band at Christiana Hospital for the first time when our group started this. So the program as such was started by us, and it obtained Center of Excellence status and recurrent certifications after that, really, with our group. And until very recently, my associate, Dr. Michael Peters, was actually the program director for bariatric surgery at Christiana Care for many, many years. Similarly, we started from scratch the bariatric program at St. Francis Healthcare as well. And until now, actually, my associate, Dr. Gail Wynn, is the medical director for bariatric surgery at St. Francis Healthcare. Also in Bay Health at Kent General, we set up the program. And until recently, my associate, Dr. Rahul Singh, was the medical director of bariatric surgery there as well. This, in addition to the fact, as you know, Kemal, over the years, we have actually trained many surgeons in bariatric surgery, not only as trainee surgeons within the residency programs, but we've had surgeons coming in to watch us do the surgery. We have been invited to go to many hospitals around the country, really, to proctor people when they started doing bariatric surgery. So we do have considerable experience when it comes to bariatric surgery.
Thank you. So I'm going to actually go ahead and open up our topic for today. We want to discuss the COVID-19 impact on our patients with obesity. And now why this is important is because it has a different impact on this group of patients. And I do want to kind of support this with some data that we have. Now, just so that who may be qualified for bariatric surgery is those patients, those individuals who are over 18 years old, and at least 100 pounds overweight, or your body index max is, body mass index is over 40. And if it's between 35 and 39, then you may need to have one of the comorbidities, and those comorbidities such as high blood pressure, type 2 diabetes, sleep apnea, and the heart problems. So one of those four would qualify. Now, as obesity is never by itself, it has so many different illnesses. It's actually kind of, it made a lot of friends in the illness world, I guess. So many diseases are together, unfortunately, now, which makes it even more complicated for those patients, those people, those individuals in the COVID-19 world. So the pandemic has so much impact on everyone. But if you are one of those patients who are struggling with the obesity, this is even more difficult for those patients. So Dr. Irgau, if you can, I mean, now we have done almost like 300 surgeries since COVID started. So you have, you've been dealing with these patients, but I just want to kind of see how those changes were made for the COVID-19 process from your side and what those patients are dealing with.
Absolutely. Obviously, as we all know, 2020 has been a very difficult year for all of us, particularly because our life has been almost totally dominated by the pandemic of the coronavirus. When it comes to the management of obesity, when it comes to dealing with patients who struggle with obesity, this has been actually even more of a problem. If you will, the pandemic has forced us into a lifestyle that is almost the perfect setup for gaining weight. And almost everybody has experienced that. I have seen that in my family members, I have seen that in my friends, and I've seen that in my patients as well, as people found themselves really gaining weight as the pandemic raged across. And the reason for that is simple. Really, we have been segregated into our houses or into a limited space. Many places that we had gone to work out have been closed because there were concerns about food shortages, particularly at the beginning of the pandemic. Hoarding food whenever we could find it in the stores was actually the norm. So there was a lot of food within the house. There was a lot of time to cook. There was a lot of pressure from the stress point of view to eat continuously to relieve the pressure. So the setup was there really for people to struggle with weight. So it was not uncommon for me to follow up my patients and then see them really gain weight as opposed to lose weight. And also, as they were in the process for preparing for bariatric surgery, even though they were in the program and seeing nutritionists, they really struggled with the weight. So it was really a very, very difficult year when it came to really controlling weight. And the reason is, as I said, it was a perfect setup, lack of physical activity, opportunity, plentiful of food, stress, and in that situation, you could see how people struggle. So we really, I spent a lot of time during consultations with my patients, really coming out with strategies to overcome that, strategies that I actually had to come up for myself also, because I am, as part of the, of the community, I am myself, I found myself in the same situation, restricted physically to a few places, not being able to work out because gyms were closed or they were not considered safe. In addition, plentiful of food and the stress. So what could we do? What could people do in order to overcome this? First thing is really to be conscious about this. The one thing that is very important is to be aware of a problem. If you're not aware of the problem, obviously it's very difficult to find a solution for it. So awareness is by far the more important step, right? To be aware that there is a danger of gaining weight during this time. And then what can you do? Of course, the basic things of watching what you eat and trying to go out and walk whenever you can, although you have to watch for social distancing and so forth, are very important. But one of the critical problems that I found people struggling with is constantly snacking, because you're around food, around the kitchen, around the fridge all the time, because you're restricted, right? Many of us have been working from home for many months. Well, home means your office is only a few steps away from the refrigerator, from the kitchen, right? Mm-hmm. So how do you combat that? Well, one of the ways, actually, Kemal, and you and I have talked about this, is to try to define time-restricted eating, which is part of the technique of intermittent fasting that you and I talked about. So if you try to decide that your eating window during that 24 hours is going to be from X hour to Y hour, then you consciously will try to eat only within those times, right? And you will try to drink water or non-calorie drinks during the other times, right? So it's the technique of intermittent fasting, which I believe is perfect for this type of situation. So the first thing is awareness, to be aware that this situation is occurring, to find out strategies. And one of the strategies, as I said, is to have this schedule in which you allow yourself to eat, and a schedule in which you are fasting, you are not eating. So really introducing that technique I found very useful for myself, very useful for my friends and family, and you and I have talked about this many times, Kemal. So that's one of the strategies that I counsel people on, and I found very, very useful.
So Dr. Irgau, one of the studies that I want to share, one from Cleveland Clinic, and the other one is from United Medical ACO. Mm-hmm. And I do want us to kind of go over these. So this number came out in March 2020. It was actually for the time of March, entire month of March 2020. Mm-hmm. These are patients with underlying medical conditions, confirmed hospitalizations. So mm-hmm. Obesity is with 48.3%. Is the number 2 most common illness. Now, because this is a specific to hospital data, I started our own kind of research-based study. It's just the foundation of the research that we may have. This is United Medical patients with different age groups, and this group of patients in this one, they are born before 1971. Mm-hmm. So I'm not in this group. What's really interesting is the percentage of the patients who have obesity. That's 60.2% of the patients who were positive with COVID-19. 60.2% have obesity. Either they have obesity or they have morbid obesity. Mm-hmm. Mm-hmm. So, I mean, I think this is really important, right? Absolutely. So Absolutely. Now, And you are our surgeon in this setup, and I'm not a clinician, but I manage clinical settings.
Mhm.
The struggle that I have when I hear these, especially in the beginning, when we stop doing procedures in the hospital setting, we still have some restrictions. Immediately, we actually put the patients with obesity out of the uh, first patients to be taken care of. We just put them out of the hospital setting, saying that no, this is not a real disease. Don't worry about it. So it's an elective surgery.
Mhm.
That I still have a problem, as you can tell. I still have a problem
Absolutely.
with that. Now,
Absolutely.
we for a long time we didn't identify this issue as a properly, and now we did, and then all of a sudden we have a pandemic, and then some hospital system or one or two or five, they said, well, obesity is not a real disease. Don't worry about it. It's an elective surgery. And it's not. Now we see it with the numbers. Initially we saw it, and now we see it with our own numbers. These patients that I'm sharing, they're not hospitalized patients. They're not all of them, at least. So when this issue is at the level of 60%, which is number two, again, highest illness, how can we actually tell the patients that, well, we're going to delay your settings? Now, we didn't.
We didn't.
Now, I want you to kind of talk about the process that we have at American Surgery Center, how we made changes for our patients, and why it's now the safest place for them to have a surgery.
Absolutely. Just to begin with, I would like to touch also upon the important point that you brought out, and that is that obesity is a risk factor for serious illness, for hospitalization, or even for mortality if one were to contract the coronavirus, right? That's an important thing that we actually discovered very early when the coronavirus epidemic hit us over a year ago. One of the first things that doctors noticed was that the people who were struggling the most with this illness or even dying were people within a certain age category, but also people who struggled with obesity. So we identified obesity as a risk factor for serious illness or even mortality if affected by the coronavirus very early, right? So that's an important factor. So protecting those patients was very important. Well, you say protecting if you think this is going to be a pandemic that's going to be over in 2 months, but we are a year and more and counting, and we're still in the middle of the pandemic, right? So yes, we do want to protect everybody, all the whole population, with the basic measures that we take of social distancing, washing hands, and also wearing masks. And whenever we listened and adhered to that, we did a great job. Okay, but the pandemic still existed. The society is still struggling, right? So trying to get people who have obesity protected is important. And now that we have the vaccine, obviously we have to give priority as well as a category. But an important point that we made as bariatric surgeons is we say, look, if we are able to do elective surgery, let's not push bariatric surgery into the back burner as if this was, liposuction or skin remodeling surgery or cosmetic surgery. This is an important medical treatment for a very serious disease, a disease that is at the center and at the front when it comes to risk factors from the pandemic. So when hospitals were talking about prioritizing surgeries, elective surgeries, and bariatric surgery was pushed in the back, we said absolutely not. We have to make sure that people who suffer from obesity are treated actually aggressively so that their risk from this coronavirus is also decreased with the weight loss that they're going to receive. So we were very much proactive in this setting in making sure that the American Surgery Center could continue safely with bariatric surgeries. Now, there was a time in which you made a decision that the American Surgery Center should hold off from doing surgeries because it was a time back in April of last year when there was really a lot of unknown, and you wanted the surgery center to hold its supplies available in case the hospitals were going to be running out of supplies. That was very important. But as soon as we knew we could do surgeries, we started doing surgeries safely. So what we did at the surgery center is, for instance, we decreased other types of surgeries that were going to increase the traffic of patients, right? We made sure that there was adequate room for patients to come in the preoperative area, in the lobby, preoperative area, the surgery itself, the recovery area, so that there would not be too much crowding, right? We made sure we tested all our patients. We made sure that we had measures in place so that everybody who works at the surgery center was also screened properly. In that way, we were actually able to safely restart and undertake bariatric surgery. And I have to say, we have done a fantastic job. Now, as it happens, being in a surgery center was actually conducive for us for this situation, because we ended up just taking care of bariatric patients and no other illnesses at that time, which means that as opposed to the hospital where patients go with all sorts of illnesses, including infections with COVID-19, when you're at the surgery center, you're much more protected against being exposed from the coronavirus. So the surgery center, I think, did a great job. It was the right decision for us to open up early and do safely. And the fact that we were able to do so many surgeries safely speaks really very, very loudly about the fact that the surgery center accomplished a very important mission really in our community in terms of addressing obesity, Kemal.
So it's so important. So what we have to go through initially, I mean, you said it really nicely when initial time when we stopped doing the procedures, because with the unknown, there was also some pressure that we felt that we had, because hospitals always have this loud voice in public, and then although we actually reach out to them and then ask them if they need any help, we would be ready to open our ORs and ventilators, make them available. There was no interest. And then we said, okay, so we have to really just do what we need to do, but we didn't take it lightly, and we actually started the process in a way that we limit the number of patients and the way the patients coming in and going out. Now, in that time though, like one really maybe important part for the bariatric patients center now is more like the bariatric center. So, I mean, we do other procedures obviously, but it was almost like a little VIP treatment for our patients with bariatric surgery, because we limit the number of cases. So now, even with this process, I mean, the pandemic going through, we finished close to 300 cases, 300 bariatric cases, and I think our team, our nursing team, also did excellent. So one other thing is, again, knowing versus something that's unknown, how our approach changes. When the patients who were positive after the testing, because we do testing right before, 1 week before the surgery, while they're actually going through the quarantine, and there were cases, maybe 3 or 4 patients were positive. In those cases, what we do is we wait for 2 weeks minimum, and then we repeat the test twice. And then once that patient is clear, then we are still able to pursue the surgery. And it may have a 4 to 6 weeks delay, but it's not a big deal. But the main highlight for us, and for me personally, when I talk to the patients, when I talk to other people, I mean, we are an accountable care organization with more than 100,000 patients. The message that we have to put out there is chronic illnesses is not something that we can delay. And then that's everything that we did for our patient population was around not delaying, because everyone initially stopped maybe treating these patients, not just the obesity, but any other non-urgent maybe patients. But that was not the right thing to do. So because you're not going to be able to delay these procedures, as you delay them, it comes back. It never goes away, but it comes back as a bigger problem with more other illnesses together. So, of course, going through this, as we mentioned, it has to be in the right setting. it has to be with the right program.
Yep.
And when you have the right people in your team, even the complicated process becomes less complicated, more simple and straightforward. And I do thank our surgeons and our nursing staff, our care coordinators, specialties who are part of this. They make it a lot easier for our patients. Now, of course, telemedicine made all this a lot easier. Dr. Bell, I know you do almost, 85–90% telemedicine these days?
I do, Kemal. So what we have done essentially is we have taken advantage of the fact that telemedicine has become much more available, and regulatory bodies were also much more relaxed about the platforms that we could use in order to reach patients during these restrictions of the coronavirus. And that allowed us really to almost exploit the flexibility that telemedicine gives both to us as physicians, but also to the patients, to really make sure that the encounters with our patients happen, right? Very often, if you have an appointment with your doctor and you have to really take 2 to 3 hours of your day to make it happen, it makes it much more difficult for that to occur. Whereas with this flexibility for patients to really be with us, taking off only a few minutes of their day, made it really very easy for us to do that. So of course, there are situations where we have to see patients in person to examine them. And what we do is we devote a certain number of hours of our office hours for that, but the vast majority we're able to conduct by telehealth, and that has been extremely successful. And in a way, Kemal, that has also helped us really follow up our patients during this difficult time, because if we were not able to see them frequently, perhaps their struggles with the weight during the coronavirus would have been a lot worse. But these encounters gave them an outlet to get to somebody that could counsel them and guide them during this pandemic. Another thing that I wanted to mention, Kemal, that is also very important is that as we opened up our surgery centers safely for the bariatric procedures, there was reluctance from patients to go ahead with surgery during this pandemic because they were worried about exposing themselves, right? But in a way, having the surgery center open for this created some sense of comfort and security for the patients, because they knew they were coming to a place where there would not be other floors, other wards, other areas of the health facility where there would be actively infected coronavirus patients. And so going to the hospital, patients were reluctant, as you know, and we talk about this in other situations. Patients, even with some acute illnesses, were afraid to go to the hospital because they were afraid of the coronavirus, right? Mm-hmm. So when it came to deciding to go for bariatric surgery, knowing they were coming to a place that was free from acute illnesses gave them a lot more confidence about the process, and therefore we were able to do the surgery much more comfortably than in a hospital setting.
Absolutely. All right, Dr. Irgau, thank you so much. So we have just a couple of reminders for our patients. As I mentioned, tomorrow we have our second event with Dr. Wade. We'll discuss the colorectal surgery and colonoscopy screening during the COVID-19. But again, this is the colon cancer awareness month, so it's important. Our goal was to open the week with him and then have another one at the end of the month. And that's what we're planning to do. And also everything that we have today, throughout the week, I think this is a really good chart that's prepared for us. There are right now 4 events that we do on a regular basis. This is kind of like your TV channel because you don't watch anything. What was that show that everyone was watching? The winter coming. Game of Thrones is over now, so no one is watching. So this is our Game of Thrones. So for bariatric, we have Wednesdays, every Wednesday, 3 p.m. With bariatric surgery journey. Every second and fourth Tuesday, 6 p.m. CHRIAS and St. Francis weight loss webinars. every Friday at 12 noon, UMACO recent updates, and every second and fourth Wednesday, 7 p.m. is Wednesday wellness webinars, which is done by our dietitians, nutritionists from UMACO. You can get these events, and then also if you are not able to get them live, you can always watch them later on. And this is pretty much what we have for today. But before we close, I'm just going to check if we have any questions that maybe we didn't address. And I'm going to ask Tanner, who is looking at those, so then later on the patients are yelling at me that you didn't answer my question. So, well, today, Dr. I didn't tell you, but today is Tanner's birthday.
Hey, happy birthday, Tanner.
He's 19 now. Are you 25 yet? 24, oh my God.
24,
okay.
Yeah.
We are not jealous.
He's a baby.
He's a baby. So we don't have any questions that we didn't address. All right, so we'll be back next week at the same time. Thank you for being with us, Dr. Ergau.